Hello, my name is Jamie.
Hi, Jamie.
I'm going to be their nurse assessing you today. Today,
Okay.
we're going to focus on our lung sounds.
Okay, good.
So today, what we're going to be doing is doing a lung assessment. First of all, I would inspect the anterior of the chest, make sure there is no abnormalities. I want to watch the way he's breathing, the rate of the breath, make sure there's not any intercostal retractions going on. We're going to make sure the skin color, the pallor is all correct, touch and make sure the temperature is right. We would also check his back anteriorly for the same thing, make sure there's no abnormalities. In the front here, we would go ahead and palpate. We're going to check and make sure there's no crepitus, make sure there's no subcutaneous emphysema going on. So we just palpate. Then we would go ahead and palpate the back as well. Anything hurt? Are you having any pain anywhere?
No, nothing hurts.
Have you had any problems breathing?
Not recently.
Okay. So prior to this?
I did have the pneumonia one time.
Okay. And how did we end up treating that for you?
Just antibiotics.
Okay, and that worked well?
It worked well.
Did you
yes.
need to do any breathing treatments?
Just at the hospital, and then when I left, they just gave me an inhaler.
So you don't have any history of asthma, COPD,
Nope.
anything like
Nothing
that?
like that. No.
Okay. All right. So now that we have checked the skin color, checked for his temperature and palpated, we will begin with the auscultation. I like to start my assessment by starting in the neck and working my way down. So we would go ahead and listen both sides, make sure there's air movement, make sure there's no stridor. Just take a deep breath and let it out. We want to make sure we listen underneath both areas. You can listen to two areas of the lobes on the sides. Make sure there's even airflow and everything is symmetrical. Okay, very good. Another thing we're going to do is we're going to do some percussion as well. So before that though, we're going to do the 99. So we're going to use the ulnar part of our hand, and what we're going to do is we're going to have the patient repeat 99 over and over again. What we're doing here is we're feeling for symmetrical on both sides, the noise resonance. We want to see if there's any difference. If there is any difference, that could indicate some kind of blood or fluid, pneumonia, tumor, something like that. So we want to make sure that it's equal on both sides. So if you could repeat after me and say 99.
99.
Again.
99. 99. 99. 99. 99.
Very good. So everything is equal on the front. In a minute, we'll turn around and we'll do it on the back side as well. First, we're going to go ahead and percuss the front. When we're percussing, we're also listening to make sure that the sides are both equal. So when we percuss, we want to place our fingers like that, and we're going to quick tap on our front joint here with our middle finger. Okay, everything is good. So I'm going to ask you now, Eli, if you could turn around so I could check the back. When we're checking the back, like we were doing earlier, we are inspecting the skin color, making sure the temperature is right, making sure both sides are symmetrical. Can you take a deep breath for me? We're looking for an equal rise and fall on both sides. We want to place our hands partially in the back, and we want to see that our thumbs move equally. Take a deep breath for me, please. And come back equally. This is showing that our chest expansion is even throughout. We also want to check his spine. Make sure his spine is even. Again, palpate if there's any discomfort, if we feel anything going on, any crepitus, any subcutaneous emphysema, or any pain.
Nope.
Okay, very good. So again, we're going to use the ulnar side of our hands, and we're going to go down, and we're going to have our patient repeat 99 over and over again. That way we can tell both sides are equal. Okay, if you could go ahead and repeat after me. 99.
99,
Again.
99, 99, 99, 99, 99.
Very good. Again, we're going to go ahead and percuss. I'm going to go ahead and tap a couple quick taps. Make sure each side is even. All right, very good. And if you can come around here. Thank you.
Mhm.
So with this lung assessment, we found that our patient has had a history of pneumonia, was treated successfully with antibiotic and a breathing treatment in the hospital. He has no history of any asthma, COPD, any lung problems in the past. And you are active and exercise quite often, and you never have a problem with any of your breathing issues.
Nope.
No? Okay.
Don't smoke.
And he doesn't smoke, which is good. Any alcohol use or recreational drugs?
No.
No. Okay. Very good. So at this time, we would say we have a normal lung assessment and that everything was symmetrical. He can take a deep breath. He can exhale appropriately. There's even lung sounds throughout. We've checked all the lobes, and we didn't hear any abnormalities during the percussion phase. And that's it.
Great. Yay.